Ever notice someone dragging large black bags through the hospital lobby and wonder who they are? That, my friend, is a medical device rep. Welcome to Device Guys. Your hosts, Brent Lloyd and Jason Doliak, bring 50 years of combined medical sales experience to the table, sharing insights, stories, and a behind-the-scenes look at this fascinating world. Enjoy the conversations.
Hey, everybody. I'm Brent. He's Jason.
I'm Jason.
We're the Device Guys. Welcome to the podcast, Jason. How do you do?
I do quite well, buddy. How do you do?
I do so good. I do really, really good.
Yeah?
I'm excited for this day.
It's a big day today. I'm liking the last couple episodes. The guests we've got have been spectacular, and we're not going to be let down today either.
We got the blue drape out.
Yes, we do. Right there.
2 in a row.
2 in a row.
We're starting to get physicians to they're clamoring to be on this show.
Oh, yeah. You should see. The line in the parking lot is deep and distinguished.
My inbox is full. I had to put some filters on.
Yeah.
Yeah.
I have a guy that wants to come on and interview us. He wants to pepper us, which is going to be an interesting.
Do I know who this guy is?
You do. But I'm just going to go ahead and keep that tucked in my pocket here.
No, I know. Yeah, I know who he is. We'll see. We'll see if he can put his money where his mouth is.
We'll see. We'll see if it happens.
Yeah. So I don't know. That's I think that would be a novel way to go at this.
I do too.
I would welcome being interviewed by this guy. I know he's very sarcastic.
Is he sarcastic? I didn't notice.
He's sarcastic. And the other thing that we have in our back pocket is we've got Zach and Diego.
Yep.
And the power of editing.
We got power of editing.
Is on our side.
It is on our side.
So bring it on,
yeah.
Doctor.
Let's do it.
Yeah. I was going to ask you a question, Jason. This is a yes or no question.
Go ahead.
Do you think it's right to send red receipts on your text messages?
I'm going to be honest with you. I don't know how my cell phone works. I don't know how to send. Would you say a red receipt? I would have called it a read receipt. Like, did he read it? Oh, yes. It looks red. You'd be right. Red receipt. I can see it, but I don't know how to do it. I thought it just happened.
It's red. It's red. It's not read.
Well, did he read it? Has he read it?
It's been read.
It's been read. Potato.
It's like if you look.
I
you
get
have
it.
kids.
This is about tense here. Come on.
Right. It's like. This is semantics.
It is.
But I know that in the app called Snapchat, if you leave somebody on red, it's not the color red.
I understand that.
Okay. That's why we send red receipts. I happen to like red receipts. I send red receipts. So people know that if they text me, and if I'm like preoccupied or too busy, they know, oh, he saw the text. He read it.
I like that. I appreciate it as well.
You get them too? I do it. I blanket. Everybody gets a red receipt.
Well, yeah. I'm gonna be making a change in my phone to make sure that everyone gets sent, so I don't have to send the thumbs up.
Yeah. What's that? That is the automatic way to send the heart or the thumbs up, right?
I will never send a heart.
Oh, I send them frequently.
I don't do it. No, come on.
Do you not love your family?
I do love
What's
them.
the matter?
I use my mouth and words to tell them.
Oh, do you?
And I'll hug them
send
occasionally.
A heart. You should send a heart occasionally. You could send the thumbs up and a red receipt. That's redundant.
That is redundant.
That's why I send the red receipt. But you know who does not like the red receipt?
Tell me.
My family.
What do they want?
They just think it's rude. They think that, Dad's too busy for his family. He can't just send a thumbs up or a okay.
Jeez.
I don't know. In my mind, I think the red receipt is a courtesy.
I agree. I think it's a courtesy.
Maybe we should ask our guest this when she comes on.
Let's get her on.
Let's get her on. Should we get her on?
Let's get her on.
Okay, everybody. This is exciting because let's introduce her. She's a cardiac surgeon at the University of Utah. We're happy to have her on the podcast. Let's welcome Sara Pereira.
Thank you so much for joining us. This is awesome.
How do you do?
Doing great, Device Guys. Thanks for having me.
You bet.
We're so excited.
So what do you think? Read receipts. What do you think?
Or red.
Or red receipts.
You know,
send them?
I had never thought of that language before, nor did I ever send one.
You don't send them.
I don't know how to send them.
See, she's the same boat as me. I thought it just happened. I thought when it comes up and you read the text message, it sends over that you read it as you opened it and read it. Like, I'm careful about the ones that I open because I don't want a red receipt sent yet.
May I? if anyone should send red receipts, it's a surgeon. It's a cardiac surgeon who is standing in a room for 7 hours at a time. And you might be scrubbed in, and you're going to have a nurse read you that text. Just the fact that, okay, she saw it. I know she's busy. She sent the red receipt. I know she's going to get back to me when she can. You don't send red receipts. I sent you like 4 texts between Friday and Sunday talking about the pod, and not one reply. I didn't get one reply. But if you would have had sent a red receipt, I would have been like, oh,
okay,
she's
busy.
It.
She's got it.
She's going to get back to me. She's on top of it. As it was Monday when you finally got back to me, and you said you were literally in the OR all weekend. Is this true?
That's true.
See, what I take from this is that we need a public service announcement on those billboards over the freeway to deliver some better understanding about this. I didn't know you had to turn it on yourself.
Maybe it should go the next campaign after ease out.
Okay.
Jason and I have a thing where if you get stuck behind the person that doesn't ease out in the left-hand turn lane, you ever get behind that person?
Yes.
It's the worst.
Is it frustrating? How do you feel about that?
It's beyond frustrating.
Well, now that I'm older, I drive slow. It's my peacetime. So I drive more in the slow lane.
Which sometimes you have to turn left.
But you don't sit in the left lane if you want to drive slow, if you're me.
We're talking about turning.
Left turn arrows. Like you're at an intersection, you're in that left turn, and when you get the green arrow or you get the yellow arrow, and you just kind of creep out to the middle. Because some people will stay back behind the line.
Oh, yeah.
And not get through you're a creeper.
I'm a creeper.
As we all should be.
Everyone should be a creeper.
Your father taught you well.
I don't know if I like that term. I like ease out better than be a creeper.
I don't know. They're both pretty green.
I think be a creeper would be a good T-shirt for the Device Guys podcast.
Be a creeper?
In the context of easing out in the intersection.
Ease out.
Yeah, ease out. Anyway, Sarah, thanks for participating in that debate. I think everyone should send red receipts.
Yeah,
and that's a crusade for me. I'm gonna keep it up.
Keep it up.
Why don't you tell the people who you are and what you do?
Well, first, I would like to thank you for having me on your podcast, and I will apologize for not answering my texts all weekend. I was busy.
I accept that. I get it. I totally get it.
So, I'm a heart surgeon, and when we're heart surgeons, we get in this really special zone when we're in the operating room, and we have this knack of ignoring everything around us, and sometimes we're in there so long that we get lost, and then when we get out, we don't necessarily go back to all the texts on our phone.
That's not your first priority when you get out of a 6-hour case.
Nor should it be.
Usually not. We try to talk to the families first, take care of any personal breaks that we might need, and have a snack.
Yeah. There's so much I want to cover with you, because the first thing that's obvious is you're a woman. You are breaking barriers on this podcast by being the first woman guest on the Device Guys podcast.
And we're proud to have you.
We are proud to have you. And I think our viewers and listeners are going to be happy to have you on the podcast. But a far larger barrier is a female cardiac surgeon makes up about, is it 3% of all cardiac surgeons? Talk about that a little bit.
Talk about the road getting.
Your road to get there.
Well, I think if you look at device reps or device guys, there's also less women in sales, right?
It's true.
Right.
So I think traditionally, chest surgery has been a very male-oriented field. Part of that is lifestyle. Part of that's mentoring. And part of that might just be that not as many women are as crazy as I am.
I love that. So you like a challenge?
I like a challenge. I like an adventure. I thought I would be a pediatrician when I was in medical school, and I just found those days kind of boring and hard to get up and kind of hard to go. And then my mentors sort of encouraged me to do surgery when I was in Cincinnati, which, by the way, I was probably the only woman to graduate Cincinnati in the 5 years I was there, because it was a very male-oriented program. But I think that I just loved it. I just got in that zone, like when I didn't answer your text for 4 days. And I just always wanted to go back and see more surgery.
I love that. So how did you grow up? Was like medicine always something you aspired to, or where did you come from to get into medical school?
So I came from a very middle-class upbringing in Northern California, where my father was a dairy farmer who was a self-taught engineer. And my mother was a very brilliant software engineer, and they met in the aerospace industry. And I had no idea what I would do. And when I went to college, my mother got really very, very ill my first year of college, and had autoimmune disease and ended up getting a liver transplant to save her life in San Francisco at age 47. And that sort of changed my life. I drove from Berkeley to San Francisco every day for 2 months and saw my mom and thought, I could do that job better, and I could talk to families better. And then I just changed paths.
Huh. When you say talk to families better, what do you, did you have some bedside manner that was really abrupt or condescending, or like how did you feel you could do a better job at it?
Well, my mother was at what was called Cal Pacific Medical Center back then. And my sister and I knew nothing about medicine, and my father knew nothing about medicine. And so I think when the physicians talked to us about all of her sudden issues, she was diagnosed at an urgent care center that she was yellow jaundiced and had end-stage liver disease.
Wow.
I think it was just really overwhelming. And for those that know me, I spend a really long time with my patients' families. And I think that that's something that I've just never forgotten. It's really scary.
Yeah.
When you know nothing about medicine and you are sitting in a hospital and your loved one's dying. And I think that's how I approach every day.
Right. That's it's cliche, but I think women do have a different way of communicating, right? Like a little maybe more empathetic. Would you agree with that, or?
Yeah, I think it depends on the culture. There are a lot of different cultures in medicine and surgery, and I do tend to be a little bit more sarcastic, yet more passionate, compassionate, maybe. I mean, there are plenty of male physicians that are passionate and compassionate, but I think depending on the culture of where women practice, I think that women can be a bit misunderstood, and that there's still definitely a double standard in our field and in our world. And,
right.
Brent, if you show up for a case and you crack some jokes when you walk in, most people say, hey, that's Brent. But if Sara shows up to a case and cracks a joke, maybe nobody will understand it correctly then, or I can't crack a joke, then I could be malperceived. And so I think that is a huge aspect to why less women go into really competitive specialties.
Right.
That makes sense.
You talked about your mentors a little bit. I bet most of your mentors were men, right? Like there were not a lot of, there's not a lot of women now. There were less then, right?
Yeah, that's true. I mean, I think that's why I do it. I have a very non-traditional path in my life where I practiced in a university, and then I practiced in a small private practice where we were very busy in Western Colorado for 10 years. And then I really did feel like we were going to lose the future of cardiac surgery if we didn't teach our residents to operate better. And so I went back to academics simply to teach. And, that's still why I do it, is I think that who's going to operate on you or me, right?
Right.
You want people to be well trained. And I really enjoy that in our specialty. So I think that's really, really important to have good mentors.
I know that's a big, I recognized that very early on after meeting you. It's a big passion of yours is education, educating these young people, diversity, all these things that kind of drive you, right?
That's true.
Yeah. And it kind of shows in the program up at the university right now with the people that are coming up through, which is great.
Yeah, my mentors were all men, mostly Caucasian men. They were awesome, incredible human beings that just, I think, took me under their arms and said, you can do this.
Yeah.
And actually, most of my mentors were trauma surgeons in Cincinnati, where it was a huge trauma program. And did I ever think I would do heart surgery? No, never thought I would do heart surgery. But ultimately, once I saw it, I just absolutely loved it. And I think you have to be a really obsessive compulsive person who likes steps, right? And you have to memorize the steps. And then to me, sewing coronary arteries is like meditation. That sounds weird, but every needle's got an angle and there's a step for every single part of the procedure. And my mentors were amazing technicians that could just operate like crazy.
Yeah. To talk about your training a little bit, like what was that like? 3.5 years of cardiac surgery training, right?
Yeah, so there's different paths to do cardiac surgery training now. So there's a path called an integrated path, which we didn't have when I went into it in 2003. Integrated paths are 6 to 8 years where folks match straight out of medical school. So we have that at University of Utah. The more traditional path that folks over, say, maybe 42-ish all did, we did 5 years of general surgery. Some folks did 2 years of research in that 5 years, so 7 years. I did 5. And then you do what's called a fellowship, which is usually 2 or 3 years. I did 3.5. I needed a little extra. I stayed around, and I did that in Alabama. And that's where I just really cherished learning how to do cardiac surgery.
Yeah. You mentioned that that there were always eyes on you as a fellow at University of Alabama.
Yeah, I mean, University of Alabama is a amazing public hospital, 1,000-bed public hospital, and we had 8 operating rooms just in our cardiothoracic floor. So, University of Utah, we have 2 operating rooms. So we had cameras in the lights in all those operating rooms. And we learned as fellows to put our heads straight under the cameras so that my boss couldn't see us. So that if we did something we weren't supposed to do, a little voice came on in the room and said, "Sara, stop that," or "What are you doing?" And so Dr. Pacifico he was Italian. He was from the Bronx. He had this great voice with a New York accent. And after he did that to you once, you would cover that light for the rest of the week.
That makes sense.
It does make sense. Weird to have someone watching every move that you're making.
Big brother. The lights with the camera are pretty impressive, man, because I'm not in those rooms very often. I'm in there for epicardial leads, but to see how you can really dial into every single step that happens, and cardiac surgery, it seems like that's very important, especially in the learning process.
Yeah, Dr. Pacifico was an amazing technician. He did over 30,000 hearts in his career, but the way he did it was that he ran 4 operating rooms. So he had 4 to 6 fellows. So one of us would run a room. And in order to do that in those days, he watched his camera in his office while smoking cigars.
That's an interesting way to do cardiac surgery.
It really is.
Makes sense. You don't really see that's like Oz looking behind the curtain.
Yeah.
Yeah.
Will you indulge me? I got a story about you. Just reminded me of a great story.
Sure.
Let's hear it.
I was up in Great Falls, Montana. I was selling VasoSeal, and which is before your time, but it was a way to get the patient up sooner. And I was there training, teaching me how to do this procedure, and it's very simple. But there was one guy there that would leave the second he was done with his heart cath. And I was there all week, and I still had not had one conversation with him. And I finally said, "Hey, what's going on with this doctor? Does he hate reps? Have I offended him?" He sprints out of the room after I still haven't done one single VasoSeal with him. And they're like, "Oh no, he's going out to smoke." And you're a cardiologist. You're in your white coat. You've got your Marlboros in the pocket of your white coat. So the next case, I followed him out there.
Have a smoke with him?
And I bummed a cigarette from him. Marlboro Red. Marlboro Red.
I think maybe you stressed him out so much he had to have a smoke after
Maybe it was the rep was stressing him out.
Yeah.
That young
Trying
kid
to learn
back there.
VasoSeal.
Yeah. But I sold him VasoSeal with that Marlboro Red.
Did you?
Mm-hmm. So I feel pretty good. So I like this Dr. Pacifico, smoking cigars indoors.
Clearly. In a non-smoking hospital.
He must have been the man, right? If you can get away with that.
it would come through the ventilation into my office.
Oh, good.
Yeah.
Yeah.
That doesn't seem problematic at all.
No.
Goodness gracious.
No. So you had 3.5 years there. You learned how to put your head in front of the camera, and then you stayed there as an attending. So that's always a feather in your cap when you're asked to stay, especially at a place like that, big place like that.
Yeah.
How long were you there doing as an attending?
I stayed for 2.5 years. I got married, had a baby, and spent my life doing organ procurements and lung transplants and a variety of heart and lung surgery. And I think my new husband and I, he was a perfusionist, said...
He was a perfusionist at your hospital. That's how you met.
Mm-hmm. And we just looked at each other one day and said, I don't know how we're going to raise kids with this lifestyle. And so I applied to a job in Colorado on a whim, and they called me the day my daughter was born and offered me the job. And so I took it. That just seemed like the right thing to do.
Well, I love that.
I'm not afraid to try a new adventure, right, Brent?
Well, I know you're not. And I know, so let's back up. So your husband, your soon-to-be husband, was a perfusionist in the room. Did you have to keep that a secret, that relationship?
Absolutely. And he was slick. He was very sneaky.
Obviously, he was slick.
Clearly.
I mean, he closed the deal.
Right.
Yeah. I mean, here I was, just a single fellow. I didn't know anybody in Alabama, and he invited me biking one day.
He's a big biker, isn't he?
Yeah.
Yeah.
Told me a group was going biking, but it turned out it was just him.
That's
clever.
That's the oldest trick in the book.
It's a good move.
It's a good move. You can go join my cycling club.
Yeah.
Come out for a ride with us.
Yeah.
Where is everybody?
Okay.
Well, I guess we just go.
Yeah.
But I was such a beat up, surgery resident fellow that I just kind of fell into it because he brought me dinner.
There you
Nice
go.
of him, yeah.
There you go.
Yeah.
And then he was right at home in Grand Junction, Colorado, the short way distance from Moab and all the good biking and
Grand
outdoor
Junction
stuff.
has some spectacular cycling.
Amazing
How'd you like it
town.
there?
Absolutely adore Grand Junction, Fruita, Western Colorado.
Mm-hmm.
Yeah, we have very dear friends there. My husband was there this week, biking.
So did you do any of those 100-mile rides with those guys?
No, I would do the 30s.
Uh-huh.
I would do the Breck 30 or the, shortest Leadville ride that there was when the guys all did the 100s. And they did the 100 in less time than I did the 30. But that was
really?
okay.
Well, so Charlie Brunson.
Yeah.
I work with him now,
Yeah.
but he was in Grand Junction.
Yeah, we know him
and
well.
He said he did a 100-miler with your husband, and I still have never met your husband. We live in the same neighborhood, and I've never met him.
Come on, Brad.
I know.
Walk up the road.
Whose fault is that?
It's probably my fault.
You didn't come see our Christmas holiday blow-ups. I invited you.
Wow.
Yeah.
I mean, I'll have to go back and look at the text.
Yeah, look at the read. Look at the read receipts.
I mean, I kind of feel like I would have known if I was invited. No, but you're having a party, right, before you leave?
Yeah.
Okay, yeah. So I will meet your husband. What's his name?
Keith.
Keith. Charlie Brunson said Keith is an animal on the bike.
Yeah.
Yeah, he said he was he said I was happy just to finish. I couldn't stay up with.
Yeah. So my husband's second career was he opened a bike shop in Grand Junction. Mm-hmm. And they did bike fitting and they sponsored events and he was super fit. But that was before he got a little older and
That's tough.
so that slowed him down a little bit.
Mm-hmm. Yeah. Yeah.
Is he a big road biker or a mountain biker?
In Alabama, road. In Utah and Colorado, mountain.
Yeah.
Mm-hmm.
Yeah. Let's talk about, I think people would be interested to hear what you guys do day to day. And because I find it, I'm in awe at these cardiac surgeons that they could go in a room and concentrate and stand for hours and hours and hours at a time and not... people come in and out of that room because they're going on break, they're using the bathroom, they go into lunch, and there's one constant. And you can have a different scrub tech, you can have a different circulator, but you never leave. Talk about what that's like and how you build up your stamina to be able to do that day in and day out. Like we joked about the whole text messages over the weekend, but you literally were in the OR from Friday through Sunday night.
Yeah, I would say I had 4 or 6 hour breaks where I was checking on other things for the whole weekend. But yeah, it was really busy. I had a 12-hour case on Friday.
12 hours. How many times did you unscrub?
That was a horribly sick patient, and I didn't unscrub.
12 hours.
I think it takes some training. I remember in my time at UAB, where there's a surgeon there named Jim Kirkland, who was one of the fathers of transplant surgery, and his dad, John Kirkland, started the program. I was in a 32-hour case with Jim Kirkland when I was in training, and he scrubbed out once. Wow. I literally fell asleep without putting my head in the field. And I think your body just kind of turns off for that time where you're just so focused. And literally, Jim was probably early 50s at the time. And I remember as a fellow just thinking, he needs to scrub out at least once. And so finally his wife, who was his scrub nurse, sent him out for like a 15-minute break, and then he came back for the rest of that time.
15 minutes out of 32 hours.
It was a really, really long transplant with numerous issues, of course, that would take that long.
No, I'm in awe.
That's superhero level stuff. I mean, you think about having to do that, but the job at hand needs to be finished, and that's incredible. Yeah.
No, patients are lucky that there's people like you that have that ability to do that, to like engage for that long.
Yeah.
I think my longest case is about 13 hours.
13 hours?
Yeah, through the years.
Yeah, I once drove for like 8 hours once, all at once.
Yeah, that's all I've done that long is drive.
I've never done anything for 13 hours.
Here to the cabin, drive. Yeah.
No. Trying to think. I've slept for 13 hours.
I've definitely done that.
Yeah.
For sure.
Yeah.
So,
music in the OR or not music?
Yeah, it's a good question. I think it depends on the culture of the center. When I was in Colorado, I listened to music. When I was in Alabama, I listened to music. I don't listen to music in Utah.
Can I make a suggestion?
Sure.
Maybe the Device Guys podcast would be good to listen to
may I make a suggestion?
Right?
Yeah. We should start in our TAVR day tomorrow. We should listen to the Device Guys.
We have TAVRs tomorrow. Let's put the Device Guys on and see how that plays.
Let's do it.
Boy, oh boy, that could easily go off the rails.
I just don't see that happening.
I don't see that.
It's not going to be. It's going to be Megan tomorrow anyway. So
You give me the best episode of the last 10, and we'll put it on.
Oh, we'll have to run Zach, can you help us run up a poll? An Instagram poll. What the best episode is? I don't know.
It's a good idea. We can get.
What's your favorite so far?
It's like one of your kids, How do you pick one?
Exactly. Exactly. So you're going to have a chance to listen to them when you're driving cross country. You tell us what your favorite is.
Okay.
And then when you get to Indianapolis, you can reveal it to them. We're going to go nationwide with this thing. Right now we're a fledgling podcast. Mm-hmm. Would you?
But we're fledgling. Yeah. We're just kids.
I hope they have this kind of advanced setup in Indiana. If not, we'll have to bring it in.
Yeah, we'll bring it in.
We can Zoom you in, no problem.
For sure.
Yeah.
For sure. What else should we talk about? What else do you want to
What are you excited about, the new job you're making?
Yeah, so you've just taken a new job.
Tell us what you're excited about.
I'd love to hear about it.
Yeah, it's a little bit crazy. It's still a little bit shocking that I actually did it. But I would say that I took a chief job in Indianapolis, and it's a great opportunity to build a state CV service line and institute. And it kind of combines my love for rebuilding the education program with bringing new recruits in. And it's a huge challenge. I'm nervous, I'm scared, I'm, self-doubting, I'm all of it. I hope I can do it.
You can do it. Yeah.
There's no growth in your comfort zone.
That's right.
Yeah.
That's why I did it.
Good.
So there needs to be more women that just step out and challenge themselves to do things like this.
I love that.
Outstanding.
I love that.
Right now we have Joe Chikwe out at Cedars-Sinai. Amazing division chief.
It's a short list.
That's about all I can think of at this moment.
Right.
But I know there are more. There's Meryl Azanian up in Toronto.
Mm-hmm.
It's a short list.
Yeah.
It's a short list. I've done this job in Utah and Colorado and Idaho. We just got a female cardiac surgeon in Idaho, Melissa Cheers, right out of training. Do you know her?
I don't know Melissa.
She's brand new, right out of training. She started. There's Betty Kim over in
I know Betty Kim.
Colorado Springs, but there it's just when you can list people off the top of your head.
Melissa Levac is in downtown Colorado. We know all. We pretty
Well, yeah,
much
I've
the
met her
women all know each other in this field, except for we don't know all the new grads.
Right.
With time, we will.
Yeah,
But it's a short list. I would say that we now are up to 415 women certified in cardiothoracic surgery ever. I think I was number 106.
wow.
And how many men are certified?
Do you know?
Yes, I know.
Well, if
2,000.
if we're
No,
talking if
more.
we're talking about 3% of that number, it's 97% more. So go ahead.
So I think 4,600 men
Wow.
have been certified by American Board of Thoracic Surgery, and few women. So that's why I think those of us that do this job need to challenge ourselves and mentor better.
Yeah. What's your advice to young women out there that are looking to get into not just surgery, but medicine in general? Like,
I think you have to find really good mentors, and you have to be good at your job. So I think in either of those categories, I think women step back, retire early, change jobs early. You're always under the microscope. People are always watching you. And I've been very fortunate that, I had a natural skill of just sewing coronaries and loved it and had good mentors. And I think I still love it 21 years later almost.
21 years. It goes fast.
How long have you been selling devices?
I've been selling valves for 13 years, and I've been, cardiology for another 15 over that. So it's been a while. I mean, I'm a little older than you guys.
Yeah, you are. I started in pacing in 2004. Moved into Casper, Wyoming.
So we're about the same age, Jason.
I'll be 50 in August.
Oh, I'm a little older than you.
Well, if you
Brett
watch,
and I were about the same.
I'm 60.
You're dead in the middle, I bet.
I'm 54.
Yeah.
But I think, as you get older, you reflect and you say, wow, I've learned a lot all those years, but darn, have they gone fast.
Yeah, they do.
quickly.
They do go fast. But I love working with you. I love my job doing valves. We're helping so many patients. A guy that I play golf with in our men's league up at Bonneville Municipal Golf Course, he could not say enough about you. You worked on him, and I think you did a full root reconstruction and some coronaries. And when I told him that you had taken a job in Indianapolis, he was visibly emotional about it.
Yeah.
He was really bummed about it. And that goes, it says a lot about you, for sure.
Yeah, it's bittersweet. I had a full clinic of patients today, lots of tears. The good news I told the patient when he emailed me about how sad he was I was leaving is I said, hey, I could see you virtually from Indianapolis, just like we could do device guys from Indianapolis.
Right.
Okay.
Right. Do you know who your TAVR rep is going to be there?
No, I know who my surgical rep's going to be there.
Okay. Do you think he'll be as good as me, Sarah?
Brent, no one's as good as you.
Don't. Yeah, exactly.
Come on.
know.
Look what's happening. Jeez Louise, way to fish.
I mean,
He
Come on,
doesn't
don't leave
show up every day. He shows up just when he knows we really miss him and think he's been on the golf course all the time.
okay.
And then
we might have to edit that
he
one out
comes
too,
to
Zach.
work.
Listen, this is a thing called supply and demand. You got to create demand with supply.
Yeah. We rotate through, but I love my time at the U. You know I do. I love my time at the U.
We love having you.
There is one other thing that was kind of cool I wanted to mention. I told Jason this story earlier, but the company I work for did a all women's TAVR team video that went out for Women's Heart Month.
Yeah.
Was it last year?
So I think it was 2 years ago. It was really fantastic. Featured Dr. Jones, an interventional cardiologist, and that was really fun.
Everyone in that room was a woman. The anesthesiologist, the perfusionist, the surgeon, Tara, the cardiologist, the circulator, the cath lab, the OR. I was like the only dude in the room, maybe me and the patient. And it just goes, it says so much about the University of Utah and about your leadership. I think it's terrific. And we're going to miss you when you head out.
Yeah, thanks. I will definitely miss Utah. I'll be back for the skiing.
Sure.
Of course.
And the biking.
Yeah.
Call Jason if you want to ski with somebody that knows how to ski really well.
I can get from top to bottom.
When you get done, call me. I'll meet you at the Porcupine or something like that.
We'll grab a nacho.
We'll get a nacho. For sure. Sarah, thanks for coming on.
Thanks for
Really
having me.
appreciate
It was fun.
Great conversation.
It was and
Great podcast.
Thank you. Yeah. Thank you. Yeah, we'll have you back on for sure. Should we sign it off?
Let's sign it off.
Hey, everybody. Thanks for tuning in. Thanks for watching, listening, however you get your podcasts. And we owe you a huge debt of gratitude. We really appreciate it. Thank you.
Yes, we do. And remember, you see someone out there without a smile on their face, give them one of yours.